taking patients all the way to Eldoret is not an easy thing. So it is very expensive. So maybe you should also tell us what are the plans that you have on the same. They were also talking about the revenue. I chair finance, and I think we are more concerned also on the revenue issues. And they also raised the same, that we are losing a lot of revenue by taking patients all the way to Eldoret. And maybe Waziri, there is also a very serious concern from members of the public that the mother and child is constructed next to the Referral Hospital, which technically offers mother and child health care service. Will it be justifiable to construct the cancer center in the same location, which is closer to the Referral Hospital, which hosts an oncology center? You also said something that the available land, the 9-acre piece of land, is enough to accommodate both. So by telling us that we reject the petition, what guarantee are you giving us that if we reject this, you will also establish the cancer center as you said? And maybe Waziri again, maybe kindly tell us again if the Cricket Cancer Center was officially adopted by the county government, or was it just merely a public reference to the intended project? And on the same again, was the Cricket Cancer Center budgeted for? If it is yes, what stage did the project scope change? And then you also give us because what the petitioners did, they did a very serious research, and I also saw in the petition they included many patients coming from Kapletunda ward. They included most of them from Kapletunda. So I wanted you to give us the exact status of oncology and how the county government intends to address the increasing number of increasing demand for specialized cancer care. Thank you, Chair. I think those are
just a rejoinder to what Honorable Nata was asked. Now, confirm if there were donor funds. And what happens to the funds now that most of the donors during the first fundraiser that was done, the funds were targeted specifically to a cancer center. Now, is it true that you redirected to the to the current MCH, or there's really some donor funding? So respond to what Nat has asked and confirm if there were donor funds that were directed strictly to the cancer center, and whether you've invested in the MCH. Waziri.
Thank you. Let me start with the last one. Probably we don't understand where the donor funding was. This was done. There was some donor funding initially, where I'm not aware as a department. But maybe the fundraiser, there was a fundraiser initially when the concept was mooted, but it was not with the current administration. So we only had. Number two, let me just give a broad view of the approach. From the arguments the petitioner has given, it's like the argument is that nothing has been done. And we cannot belabor the fact that we've done something. First of all, to establish the requirements for a cancer center. Number two, provide infrastructure which will be supporting the main cancer center. That's why we are talking about the mother and child. Number three, the issue of rising numbers, and I agree with Dr. Birich. People probably are coming out more, and we are detecting some which we will not have detected. But the approach to cancer, even the national policy, states that there should be more on prevention. And that's why whenever we give talks, whenever we have outreaches, part of that Beyond Zero is where we screen mothers, and we provide privacy. We screen fathers when they are there. So our approach has been on the prevention and emphasizing on primary prevention and primary care. So we are doing something about it. Number two, the cost is very high, as Mheshimiwa has said, that going to MTRH is very costly. But we've tried to mitigate that. And I said, patients who go to MTRH, they just want to have a blood transfusion. So what we do, we collaborate with MTRH, we tell them we will transfuse here, we check their blood, they go with the results. So they go and they lessen their stay, they lessen the times they will visit, because they will just go for blood, then they come back, they go for chemotherapy. We are able to do and support that because we have a blood bank and we have a very nice working relationship with MTRH. Chemotherapy. When somebody has been initiated with chemotherapy, we tell them that they can refer them back to us. So we reduce their visits, and that also tries to mitigate the cost as we try eventually to have a cancer center in our setup. They also go sometimes to go and get a specimen removed. Some of them is just the bone marrow or a biopsy. We do them currently here because, as I told you, we now have specialists, neurosurgeon, we have a general surgeon, we have a gynecologist. There was even a time we had a urologist, although he was poached away from us. Those specimens can be removed here, and the specimen itself is referred to another lab, and we do. So we've tried to mitigate the issue of the cost, as Mheshimiwa is saying, and I agree. Part of the cost of cancer is not just the treatment. It involves even the lodging that you have to stay for 3 days or 4 days or even a week after the chemo. It involves having an extra person to accompany you, extra person or extra persons to accompany. It involves even people going just for results, going back. But with our current setup is that once the results are out, especially for biopsy, we receive the results ourselves and we convey it to the patient, and then we consult the teams there. And that addresses the issue of rising cases. We don't dispute that the cases are going. And I've said the approach to cancer is multi-pronged. Part of it is prevention, then the treatment. And then I agree revenue can go away from ourselves, but eventually we must save life as we try to progressively improve our part. Let me leave the other part, especially on the facility sitting next to the county referral and the adoption and the budget to the chief officer.
Thank you, Chair. Just to add, we will be getting additional endoscopy machines before June. That speaks to a deliberate effort in making sure that we mitigate on this. And Chair, Dr. Ari and the team will tell you that the most critical part of this treatment is early detection, early screening. And because that is the critical aspect of this, and as a department, what we have done, like Waziri has said, is that we have expanded the screening services, not only through the Beyond Zero, not only through the regular medical camps that we are doing, but to high volume health centers, level 3s, so that mothers can be screened early in those particular facilities. With this, it speaks, if you look at the data before the establishment of oncology center in Logisa in the facilities, compared to now, it will show you a decline in some of these cases, and that can be attributed to the early detection. When we speak of 500 patients that are getting care in Logisa, that should speak something on how particular we are on this. Number two, Chair, to the best of our knowledge, we didn't get any budget initially from the previous government that was dedicated to this. So we don't have any budget that was forwarded to it or any account that we were told kuna pesa iliweka hapa for the oncology center. So to the best of our knowledge, we are not aware of that. Number three, the issue of the mother and child sitting closer to to Longisa. And let me paint this picture, and I wish the committee will have time to also visit the facility. Longisa do deliveries in a month of up to 600 mothers. 600. That facility was constructed in the year 1993. The capacity then was to accommodate a maximum of around 64 mothers. Yes. And then with that number of 64, this again has been reduced because there was the creation of a theater that is dedicated for the maternity wing, Yuilikula, a section of it. There was a further dedication of the NPU, the expansion of the NPU. That has also reduced that section. There was also the creation of the Kangaroo section. That has also further reduced the capacity that hospital was initially supposed to accommodate. So as we speak today, if we visit Longisa maternity wing, beds have been placed along the corridors. There is no free space. Any free space has a bed. And every bed, we don't want to say this publicly, but we need to say is that mothers share those beds. So you'll find one bed with 2 mothers. This is not ideal, even when it comes to infection prevention. That is not only Longisa. Recently, and last year, in October, we initiated deliveries in Bomet Health Center, just here in town. As of yesterday, mothers were also sharing beds in that facility. That is just to paint a picture of how dire the need of having an expansive mother and child hospital is. So that facility is not only timely, it has delayed. And any other further effort to derail its operational will only impact more negatively on the mothers' deliveries of babies. Let me say, Chair, as a county, and we don't have at the moment what we call the high risk delivery unit. This is for, again, the mothers who might be battling the issues of the cancer, high blood pressure, and several other issues. This facility will offer that. At the moment, we don't have a comprehensive ICU center. This is a center that even the oncology patients will require. In the new facility, we have around 12 and yes, we have 12 for adults and 8 for pediatric ICU center. That speaks to the delivery effort, not only to deal with the issues of the mother and child, but to also ensure that we are able to even further manage the oncology patients who require intensive and care services. So when it comes again to the mother and child, there is what we call shared resources. So that, for example, we can utilize the comprehensive lab in Longisa for the patients who are in MCH. We can utilize at the initial stages the CT scan that is available in Longisa for the same patients who are, so there are several shared resources. That is why when you go to MTRH, you'll find that their facilities are established in almost the same environment. When you go to Longisa, they are established in almost the same environment. When you go to Kenyatta National Hospital, all these big hospitals, all these facilities are put in close range because they share a lot of shared equipment and resources. And that is why mother and child comprehensive care units will be more ideal to have them in close range so that the other shared resources can be shared. For example, you will have say nurses, we will have the consultants that we have at the moment. We have one oncologist, we have a neurosurgeon, one of them. We have some around 2 general surgeons, and of course with one called Apollo, who is currently helping us. These consultants and pediatric oncologist, we have one. So they should be able to attend to the patient in MCH and Longisa without using a lot of resources and being available for this patient within the shortest time possible. Because when it comes to healthcare, again, the time of response time is very critical. So when you have the resources close together, it would be very ideal to share the equipment and also to share the human resources that we have at the moment without even using further resources like fuel and getting vehicles to transport the consultants that you have and the doctors to very far length. So it is only ideal. Thank you.
Thank you, Chair. On what Mheshimiwa said, Mheshimiwa member of this committee said the scope changed. I want to say that we have not changed the scope. As you listen to us, we have been trying to be progressive so that we can provide all other things, except maybe the very detailed linear accelerator and the CT scan. On the budget, I think there was a time we budgeted for the cancer center, only that I think the money was reduced. So it was not making I think there were other issues that came in and the money was removed from our budget. And to make a commitment that when we turn down this request to stop MCH, the guarantee we are giving is through the effort you've seen we've done, we are addressing the issue of cancer. So stopping that service will not be very helpful. It is to agree with the petitioner to even join us in the effort to address the same issue. So there is a guarantee because already we've established, we've trained, and we are going to do the next step that is necessary, especially on infrastructure when resources are availed to us. Thank you, Chair.
Because of time, I will be requesting that to the members and also the responders, let us limit time to 2 minutes each. So let us package the questions and responses to be elaborate and we avoid repetition so that we...
Thank you, Chair.
Welcome, Mheshimiwa.
Bwana Waziri, I will take you back to that issue of fundraiser so that you can elaborate more. The petition has alleged that members of public contributed funds toward the purchase of land intended for establishment of a cancer center. Can you confirm whether the public fundraising occurred, whether such contribution were officially sanctioned or documented by the county government, whether records exist showing contribution, amount raised, and the intended purpose of the land acquisition? Again, if community members contributed financially toward land acquisition for cancer center, was the county government aware of such contribution? Did the county government enter into any agreement, commitment, or representation to the public concerning establishment of cancer treatment center at Jeb Cricket site?
At a rejoinder, we've checked on the CIDP cycle of 22-27. There was an intention or original intention to have a cancer center at Longisa, and the location is stated as Longisa Ward. Then the MCH was to be located at Youth Farmers, that is still at Longisa Ward, and the cost was to be 300 million. The cost of the MCH was to be 750 million. Now the first question would be, we are implementing the MCH outside the cycle, the intended cycle that was for 2017 to 2022, and now we've abandoned the cancer center, which was stipulated to be implemented within this CIDP cycle of 2022-2027. Additionally, the budgeted amount was 300 million. Maybe a starter figure was to be 300 million. And the County Department of Health has progressively been implementing other projects that could be even beyond that figure. Have the county have you engaged with the committee, the sectoral committee on this assembly, purposely pursue or to push for the budgeting of the amount that you've stated, and also the budget committee? That is my question. Proceed, Waziri.
Thank you, Chair. On the issue of the fundraiser, I must say that we are not aware of what transpired during whether there was a fundraiser. What we are aware is that there is public land that is at what is the name given? There is a common name. Mungunyat is the other name. And I think we are all aware that there was a public participation when we did the mother and child. And there was agreement that we can have it next to that. Our plans have also included location of a cancer center at the same facility. In 2017, because I had the privilege of serving in this same administration, there was a time we were to construct the facility, mother and child, in Longisa. But the terrain was putting the cost, I think 1.2 billion at that time. And we wanted the support of the national government. They turned down because the cost was going to be extremely high. So we had to look for alternative land, and that is why we settled at the Chep Cricket, because the cost was going to come down. I think it came to around 300 something. So I don't have details on this 750 million, which you've stated, Chair. Maybe we can look at them again, given time. But let me just donate 1 minute to the Chief Officer. Then we back to you, Chair.
Thank you, Chair. One, let me clarify. We have not abandoned the dream of having the cancer center in the cycle of 2022-2027, just as you have stated. And we have demonstrated extensively the efforts that we have put in place. And that is why we requested, Chair, that by dint of this petition, if the committee, the budget committee, will allocate to us initial 300 million, we should be able to initiate this process. Again, the project of mother and child began in 2022. So it was within the cycle of 2017-2022. It's only that the project crossed over to the next financial year, because definitely this was a huge project. So we are obedient, we are loyal to the CIDP. I think we got the figures from the CIDP, which again is a wish list. You'll pick on them based on the resources that you have been given, but it has always consistent. It is in our CIDP, it is in our CFSP, and it's a request that even the members who brought this petition, currently there is the ongoing public participation on CFSP. And there'll be again a further public participation by the county and assembly on the CFSP and even the budget estimates. We also request them that they also voice their concerns so that together we can push for the allocation of the resources, because it is good to bring the petition, and it's also good for them to be to always be very active when it comes to allocation of the resources, so that at least this is not only a narrative that comes when. Thank you, Chair. Now, and the last one, Chair. Like I said again, we'll request that at least let's get some of these members to be part of our committee, because from this petition, it appears that they don't really understand the efforts that the county government has put in place to deal with the issues of the cancer. So if we can have some of them, at least they'll be in a position to appreciate the efforts, and together we can actualize this. So we can have them on board so that they can understand and they can speak from the point of information. Thank you.
You, Chair.
Honorable Marangi.
Thank you, Chair. I just want to ask only 3 questions here. What legal or administrative safeguards exist to ensure that public expectations linked to community the projects are protected when project purposes are changed. Number two, can you explain why the county government believes on MCH facility is higher priority at the site compared to the specialized cancer treatment facility? And the number three, what assurance can the county government provides to residents that the cancer care infrastructure remains as a priority with the county health agenda? Thank you.
Thank you. Oh, yes.
Yes.
Thank you. Thank you, Chair. When things are changed, it's normally through interactions with the users in terms of the service providers. And some of these things are advised by maybe trends within the national government. Like if you check currently, we are trying to prevent maternal and child deaths. And that is one of the driving force even, and it has been before. The statistics in Bomet have been very alarming for a county like ours. And part of the reason why the emphasis on mother and child was put has been aptly said by the team here that there is serious congestion. In fact, I would invite this committee to visit the maternity and even look at the newborn unit. The newborns are put in one cubicle. There could be 15 in maybe some incubators, and it really tells you that there is need. So whenever such occur, it is at the recommendation and in trying to fulfill the national interest. But whenever such a change is also required, we involve the executive through memos and even papers that are presented to gain support, especially where budgets will be involved. So we have finally a public participation, which will address what the community feels about what we are suggesting. But sometimes some of the suggestions come from the community and we take up. So it is collaboration and talking to each other. On the issue that we believe MCH is of higher priority, we've stated in our write-up that both are priority. And